Happy Friday to all of my fellow Mississippians, and thank you for joining us on what is a wet Friday afternoon. As we mentioned earlier in the week, our numbers are improving, and it is because of your efforts. As we know, our 7-day average peaked at 1,358 cases over a 7-day period on a daily number. Today, over the last 7 days, that number is less than 800. If you look at what occurred 3 weeks ago, we reached a level of approximately 9,100 cases. If you look 2 weeks ago, as I mentioned on Monday, we had gotten that number down to 6,700 cases over the 7-day period. It appears, based upon my back-of-the-envelope math, that we're going to, again, reduce that number over the 7-day period from Saturday to Friday down to about 5,500. So we did about a 30% decrease from 3 to 2 weeks ago. We did approximately a 20% decrease from last Friday to this Friday. So the numbers are going in the right direction. That is something we should be proud of, certainly something that I am proud of, but I also know that that just gives me even more reason to work even harder over the next several weeks. Because if we can have 2 more weeks like we had the last 2 weeks, and we can cut these numbers in half again, then we will be in a much better position, and we'll be back near where we were in the March and April timeframe in terms of community spread. If we stop working now, if we pretend like we've done our job, then the numbers are going to go back up very, very, very quickly and very rapidly. We also know that hospitalizations are a lagging indicator, much like deaths and fatalities are a lagging indicator. If you look at our hospitalizations today, if you look at both confirmed COVID plus suspected COVID in our hospitals, that number is about 1,120. That number peaked a little over 1,250 3 weeks ago. So we're down a little over 10%, but we've got to keep working. We need to, again, cut that number in half, and we can over the next 4 to 5 weeks if we can remain very, very, very diligent. And so my commitment is to continue to look for ways to reduce community spread. And we know that one of the most important topics that we have to consider is education and the activities that surround education. I believe in my heart that we can work to educate our children while also keeping the community spread of COVID-19 to a minimum. I'd really want to commend everyone across this state who has been working hard to ensure that our children get a quality education in spite of this global pandemic. One of the open questions has been about sports and other extracurricular activities. First of all, we can be adults. We can admit that every activity in life carries risk. There is a reason that ambulances are parked outside of high school football games in a normal year. We also know that we can and we must manage those risks. I believe that sports and these other activities are instrumental in the lives of young Mississippians. They teach discipline and responsibility in a way that cannot be replicated in a classroom. For many, it's these extracurricular activities. It's football, it's soccer, it's band, it's other things that are the ticket to a college degree and a new life. For the rest, they provide a structure and an incentive to learn. I don't know how many more high school dropouts we would have in this country without sports. I do know that several of my buddies growing up only took their grades seriously because they took sports seriously. They cared an awful lot about what they had to do to maintain a GPA so they could stay eligible to play. Some in academics might say, well, that's foolish. And maybe it is. But I do know this, it happens. It happens in every single high school across Mississippi, and it happens in every single high school across America. Having said all of that, we also know that we are living through a pandemic, the likes of which this country has not seen since 1918. One of my greatest concerns heading into this school season has been sports and those other events which cause the community to come out in large crowds. Please hear me say this. 22 players on a field is not going to overwhelm a local hospital. 22 players on a field is not going to overly stress our healthcare system. However, 2,000 people in a small school's bleachers absolutely could have that effect. And because of that, and because I want high school sports and I want college sports to continue, I have already signed an executive order today. Now, it is dealing only with high school sports. We will continue to discuss college attendance in the days and weeks to come. But I have signed an executive order that extends our current rules in our EO for 2 more weeks until the last day of August, August 31. And in addition to that, I've signed an EO that places an attendance cap on extracurricular activities like sports. All K through 12 schools in Mississippi will be required to ensure that no more than 2 spectators per participant are attending. That may mean 2 parents. It may mean your dad and your sister. It may mean your mom and your brother. It may mean your best friend and your boyfriend. But only 2 spectators will be allowed for each athlete or for each band member, cheerleader, or other participant in whatever extracurricular event occurs. We are doing this until the end of August. We will evaluate how well schools are enforcing it, and we will evaluate if we are successful at continuing to drive our numbers down. I believe that this is a prudent step to help us ensure that we can keep kids in the classroom, which is our #1 priority, while also giving all of those kids with extracurricular activities an opportunity to perform, to compete, and to learn valuable lessons in life. Now, I understand that this is not going to be popular with some. I totally understand that. But what I want all of my fellow Mississippians to think about is when we talk about high school sports, is it for the family or are they for the student athlete? If in a pandemic we can protect the student athlete and protect your families at the same time, then we will be accomplishing something. A goal that I believe is worth fighting for. I understand this is not fun, but it is necessary. As we work to continue to improve our numbers, I believe that we have to take these steps. To all of my fellow Mississippians, please continue to stay vigilant. Please wear a mask. Don't go to parties. Don't let your guard down. We can beat our common enemy. We can beat this virus, but we can only do it if we're working together. So with that, I'm going to turn it over to Dr. Dobbs and let him give us an update on the numbers.
Thank you, Governor. So today we're reporting 944 new cases of coronavirus with 32 additional deaths. We are continuing to see this maintained moderation in our daily case counts, so would again reiterate the importance of maintaining our efforts at social distancing, masking, and small groups. Regarding hospitalizations, we have had some stabilization in our number of occupied hospital beds. We did have a bit of an increase in daily hospitalizations today, but overall we've had stability. But still, we have 11 hospitals with 0 ICU beds currently available. Looking at our deaths, we sadly have seen deaths in some younger individuals in Mississippi this week. We're reporting the death of one teenager with no underlying medical conditions, and also a young pregnant woman in her early 20s. A reminder that although severe illness and death in young people is unlikely, it does occur, and we should all redouble our efforts to make sure that we prevent transmission. If we're looking at the schools, so far we have 38 counties with schools reporting cases of coronavirus. Within those different schools, and it's more than 38 schools, it's just that's the number of counties, we have 109 teachers who are confirmed cases and 69 students. If we look at those who are quarantined, we have 254 students and teachers and staff that are quarantined, and 489 students that are currently under quarantine. We are performing surveillance of daily cases or actually weekly cases through the Department of Health, and are mandating reporting from each school to the Department of Health so that we can monitor activity. This is applicable both to private and public schools. We have also assigned 9 outbreak teams throughout the state. Each county will have a specific outbreak team that's there to assist not only with responding to outbreaks, but also for answering questions. And we've been in regular communications with school leaders to make sure that they know that they can contact them for assistance. And in regarding the schools, we'd like to reiterate that face shields do not supersede the need for masks. Masks are still required. Shields are an added element of protection, but masks are still necessary. We have also at the Department of Health instituted our new surveillance software, and we're seeing improved efficiency, so hopefully we'll have better operations going forward even than we've seen thus far. And finally, would like to announce that next Thursday, Friday, and Saturday, the Department of Health and National Guard testing teams will be working with the Mississippi Band of Choctaw Indians to perform universal testing at the Silver Star Casino parking garage in Choctaw, Mississippi. We're encouraging everyone in the area, members of the Mississippi Band of Choctaw Indians, and also people living in the surrounding communities to please come in and get free testing. You don't need to have symptoms. You don't need to have been exposed. You don't need an appointment. Just show up and we'll test you. So please come in next week, Thursday, Friday, Saturday, at the parking garage of the Silver Star Casino. And Governor, that's all I have for today. Thank you.
Thank you, Dr. Dobbs. I just want to point out for the people of our state, again, I will preface this by telling you that these are total cases in 2-week periods that are about a week behind, because that gives us the ability to have complete data. And so, full disclosure, and CJ does a great job with following the numbers. But with the data that we are looking at, I just want to mention, we have a statewide mask mandate. And what we're seeing, as I mentioned earlier, is improved numbers. We're seeing the numbers over the 7-day period go from 9,100 to 6,700 down to about 5,500. That's very good. And in most counties, we're seeing a total case differential since the last 2-week period that is negative. In other words, we're seeing far fewer cases in a lot of counties. We still have a statewide mask mandate, but I want to just point out to those of you who live in Bolivar and Forest and Jones and Lee, as well as Union and Panola counties, just FYI, we are seeing less community transmission. We're seeing much lower growth in those counties, but we are seeing positive increases in cases. And so again, I want you all to be extra diligent in Bolivar and Forest and Jones and Lee, Panola and Union counties. There are a couple other counties such as Lowndes and Warren County where The case numbers are coming down, but they're coming down at a relatively slow rate, so they're really stable and relatively flat. And so for us to really continue to drive numbers down big, where we get that R0 number down below 0.9, which is where we are sitting today, we need it down below 0.9 in every single county. Remember, R0 is actually for every one person that has the virus, how many they are spreading it to. When that number gets up above 1, it is particularly bad because we see growth in cases. When it gets to 1.19, which is where it was 3 or 4 weeks ago, the exponential spread can really catch up, and that's what gets you in big trouble. Likewise, if you can get it down below 0.9 or even preferably below 0.8, you can start seeing significantly fewer new cases very, very quickly because of the way in which the mathematics works. And so again, please continue to stay diligent statewide, continue to wear a mask statewide. But I did just want to briefly mention, as I did on my Facebook Live yesterday, those counties, just to be a little extra diligent and a little extra vigilant in those counties. With that, I'm going to turn it over to Director Michelle, who is back with us today after meeting with local elected officials throughout the state, and let him give us an update.
Thank you, Governor. Good afternoon, everyone. I did have good meetings earlier this week with members of your Board of Supervisors as well as your city and county administrators talking about the Mississippi COVID-19 Emergency Relief Fund. Good meetings, good dialogue. As of today, we've received approximately 644 applications. We just want to remind everyone that's listening that the Mississippi Emergency COVID-19 Relief Fund is for counties and municipalities only. This is not a program for individuals and certainly not a program for small businesses. So please, if you would, just be aware for that and be mindful of that. And my folks will continue to direct you as best they can to other resources as they become available. Also want to reiterate the deadline. These applications will remain open until October the 15th. So please continue to work in getting your project work statements in for both public assistance and the CARES Act 100% reimbursement track. As a reminder, resources are available at my website at www.msema.org, as well as our call center. That number is, again, 1-844-522-7367. Just quick tropical update. It appears that Tropical Storm Josephine will continue to make that right hook off into the Atlantic. So once again, that's good news for us, and we'll continue to watch it as it moves out along the East Coast.